Photography is a critical part of a comprehensive dental practice. Too many times dentists are trying to communicate dental treatment and dental conditions with patients verbally. Well, the patient can't understand what you're talking about. So I've always used photography to communicate with patients so that they understand precisely what their dental condition is and what their treatment options are. Now, this is the camera I'm using right now. This is a Canon 77D body, a Canon micro 100mm lens, and a Canon macro ring light MR14EX2. I used Nikon for many years. This is a very effective and fairly simple camera. The settings for dental photography are M160 shutter speed, f-stop 32, and ISO 200. M is what I use when I'm taking intraoral photography. And you set this dial this setting right here to MF, which is manual photography. Now, if I'm taking a full face shot, I move this to AF and I move this to P. So P and AF. If I'm taking intraoral shots, I move this to MF and move this dial to M for manual. Another setting that's very important is this setting right here, which is the dark or light of the flash. So you push this, and right now, if you move the button to the left, it makes the photo darker. If you move it to the center, so you push that, now that's neutral. I wanted it just a tiny bit darker, so it's one click to the left, and you don't have to reset it, just leave it like that. If you want it to be lighter, if the photos are too dark, then you push setting, make the dark come on, and you move it to the right of the neutral button. So I want it one click to the left. Okay, let's take some photos. And these are the photos I take of every new patient prior to their consultation. So I'm setting this on AF and this button right here on P, and this is going to be a full face. Would you say a big cheese, please? Beautiful. Then I'm going to reset this button to M and this one to MF, manual. And it's very important that you have the right mirror system and retractors. So I like the single retractors right here, and we put Vaseline on the retractors and on the patient's lips. Louisa is going to place Vaseline on the patient's lips. Now this is just of the smile. Say big cheese, please. Cheese.
Cheese.
Now lick your lips and let your lips just hang. Just say, good. This is showing lips in repose. Remember, you always want to have some tooth display with the lips in repose. Now, Louisa, would you place those retractors, please? Now bite down all the way, please, and turn my way. That's the teeth together. Now open just a little bit, please. That's the teeth apart. Notice I don't have a lot of lips in there. You want to hone in on the part that you're interested in. Now bite down again and turn my way, please. Turn my way a little bit more. That way, just there. And this shows a fraction, exposed crown margins, gum line decay. Now turn that way just a little bit. Bite down all the way. These are two lateral views. Okay. Now Sharon, would you reach up here and hold these, please? And I want to hold these retractors up and out as far as you can, kind of between your eyes and your ears. And turn my way, please. Okay, the small. And blow a little air on this occlusal surface, please. You want to blow some air on the occlusal surfaces of the teeth. Open real wide. Got some nice dental work done there. Now when you take this view, You want to take it straight on, not at an angle. So if the teeth have cracks or there's leakage around fillings, you can see that. You don't want to take angled view. You want to get the mirror so that you're taking a view straight on at a right angle. And it's right angle so I can see any cracks, leaky fillings, anything like that, okay? Now come up this way just a little bit, perfect. And this shows worn incisal edges. Okay, now down, and you want the patient to hold these down and out as far as they can. Little air, blow a little air on those, the occlusal surface of those teeth, please, Lisa. Good. See, straight on. Then one more. The incisal edges of the lower anterior teeth and the lingual of the lower anterior teeth. So this shows any buildup. Thank you, Sharon, you can take those out. So this shows any calculus buildup on the teeth or chipped incisal edges. So those are the photographs we take of the teeth. So you've got a full face, a smile, lips in repose, incisal edges, retracted teeth together, retracted teeth apart, lateral left view, lateral right view, upper right posterior quadrant, upper left posterior quadrant, and upper anterior quadrant, that's 10, lower left, lower right quadrants, and lower anterior quadrant. So that's 13 photographs in all, and we're going to use these in my private office at the patient's consultation appointment so that she can see what her teeth look like. I'm going to use the black books ahead of time so she sees what pathology looks like or what the restorative options are. Then when she looks at her teeth, the objective is she can diagnose herself and make an informed decision regarding what, if any, dental treatment should be done.